Today, we're diving into the fascinating history of neonatal care in Denmark,
Yeah,
especially focusing on the care of premature babies. Let's jump right in.
I'm really excited about this. What's the main development we're looking at?
Well, it's interesting. Back in the early 1900s, nurses were the primary caregivers for premature infants, ensuring
Mm-hmm.
warmth, proper nutrition, and preventing infections. Doctors weren't really involved much back then.
So doctors didn't play a big role?
Exactly.
Hmm.
There weren't many doctors interested in premature babies at the time. The care focused on keeping them warm, feeding them, and protecting them from infections, core nursing tasks.
That's really fascinating. So what determined whether they tried to save a premature baby?
It was solely based on the baby's weight.
Really?
If the baby weighed under 1,000 grams, it was considered hopeless. Between 1,000 and 2,000 grams, they might use an incubator and give oxygen. Over 2,000 grams, the baby had good chances of survival and could often be cared for at home.
Wow, that's quite a rigid cutoff.
Yeah. And interestingly, up until the 1960s, most women gave birth at home.
Right.
At home, they were less strict and would wait to see if the baby showed signs of viability.
So they took a wait-and-see approach?
Exactly, it wasn't as
Yeah,
categorical as in hospitals.
that's intriguing. About oxygen therapy, you mentioned incubator blindness?
Yes, since premature babies often have underdeveloped lungs, they need extra oxygen.
Uh-huh.
Initially, they gave pure oxygen directly into the incubator, but that could damage blood vessels in the eyes, leading to incubator blindness.
That's terrible. Did they change their methods?
They did. They learned to regulate oxygen levels to prevent that condition. It
Right.
was a significant improvement.
Good to hear. And nutrition was also critical, right?
Absolutely! Nutrition is crucial for survival.
Yeah.
Back then, they struggled to provide enough breast milk for these babies.
How did they address that?
They established the Women's Milk Central in the 1940s, where mothers could donate surplus milk and were paid 2 kroner per liter.
Interesting.
But they still couldn't collect enough to meet the demand.
That's challenging. So an early form of a milk bank?
Exactly.
Got
Today
it.
we have 3 milk kitchens in Denmark that receive and process donor milk.
That's great progress. How does it work now?
Well, the milk is pasteurized and categorized based on protein content.
Right.
They use barcodes to ensure babies get milk from their own mother when possible.
That's fantastic, but doesn't pasteurization reduce some of the beneficial properties of breast milk?
Well, pasteurization does affect some components, but it's necessary to eliminate potential pathogens.
I see.
The safety benefits outweigh the slight nutrient loss.
Makes sense. Safety first.
Exactly. Very premature babies can't suckle or take a bottle, so they receive milk through a tube. The first step to prepare them for breastfeeding is skin-to-skin contact, or kangaroo care.
Skin-to-skin contact. It has significant benefits, right?
Absolutely. Studies show that the more the babies are held skin-to-skin, the faster they establish full breastfeeding.
Right.
In Uppsala, Sweden, they excel at this practice.
Really? What are they doing differently?
They emphasize early and continuous skin-to-skin contact, even with babies born before 28 weeks. They've
Wow.
seen babies establish full breastfeeding at just 32 gestational weeks.
That's impressive. Is that common?
It's rare but becoming more frequent with these practices. Typically, babies establish full breastfeeding at 36-37 weeks.
Does it depend on how early they're born?
Definitely. The earlier they're born, the more challenges they face. Early exposure helps them develop feeding skills.
So even before they can suckle, they get to practice?
Yes, they might just lick and taste at first.
Mm-hmm.
The more they practice, the better they get. We ensure they receive nutrition via tube feeding until they can feed themselves.
That's wonderful. But with so much handling, isn't infection a concern?
That's a good point.
Yeah.
But with proper hygiene and protocols, the risk is minimized. The benefits of close contact are significant.
I guess that makes sense. The pros outweigh the cons.
Exactly. It's all about balancing risks and benefits. Nurses play a crucial role here.
Speaking of nurses, they've been central in this care, haven't they?
Absolutely. Nurses are at the forefront, supporting both the babies and their families.
Right.
Their role is invaluable.
Do you think there's more we can do to improve?
Definitely. We can learn from places like Uppsala and enhance our skin-to-skin practices. Collaboration is key.
Maybe we should adopt some of their methods.
Agreed. Sharing best practices helps us provide better care.
It's been really enlightening discussing this.
Likewise, it's important to reflect on how far we've come and what more we can do for these tiny patients.